Hiya, it's Nikki from Sarah Aesthetics and Wellbeing. I thought I would do a quick video on how to know that your practitioner is a safe practitioner when you decide to go and get Botox fillers. I promised myself that I would do some videos over 2020, so that's my New Year's resolution, so hopefully you'll be seeing a little bit more of me. I've got some notes, so if I'm looking down, that's I'm not purposely trying to avoid the camera, that would be why. So we are looking at how to choose your practitioner and whether you can decide whether they are a safe practitioner or not. It's very, very difficult in today's society in terms of aesthetics because it is an unregulated industry. So hopefully we can give you some pointers on how to decide whether your practitioner is safe, and hopefully this can help. So the industry is unregulated. There is nothing stopping anybody from picking up a needle and putting it in your face. The only real stipulation is whether they can get insurance. And I'm sure that there are probably some practitioners out there that are working without insurance. Most practitioners, I would have thought, would have a printed version of it somewhere. There's absolutely no harm in asking for it. So that's always the first thing to look for, is whether they've got one to show you. The other thing is there's a massive argument in the industry about medics or non-medics. Actually, I kind of sit in between that as a diagnostic radiographer, so some people class me as a medic and some people class me as a non-medic. That's kind of where I feel that I sit as well, but it does mean that I'm in a unique position because I can see both arguments, and I have respect for both opinions. It also means that I'm in both sets of groups, so I see a lot of frustration between both classes of professional, and it can get quite nasty occasionally. But that being said, I can't say that medical professionals are necessarily 100% the people to go to all the time, because you do hear stories of medical professionals not doing things right. There was a nurse that I've heard of locally to us that was struck off the register for putting Botox back in a bottle after putting it in somebody's face, which there's obviously a risk of cross-infection control, and the clients were worried about HIV, quite understandably. And then you've had nurses doing Botox parties. I've heard of a doctor who did cause a vascular occlusion in somebody's lips, and they didn't know what to do and they had to go home and print out the protocol. I've heard of surgeons causing filler blindness. So it's not that it doesn't happen, it does happen. I just think that the media portray it as more the non-medical professionals causing more problems. But it does happen. We can't see what's under the skin, so it can happen to anybody. But there are certain things that we can put in place to help prevent it. Going to someone who is medically trained, there are certain benefits. We do have to uphold certain standards of our registration for us to be able to stay registered. And it's things like not working outside our scope of practice, so we respect our knowledge and our experience and we won't go beyond that. Confidentiality is also another big one. So respecting clients' confidentiality, we won't go raving about we did this and we did that, unless we have their permission, which is why you'll see that we do sometimes, but it's only ever when we've got permission. We would never tell anybody, if we had a friend in, we'd never tell them what we did to you, unless they brought up what happened first. And it's to respect your privacy and to uphold the standards of our professional registration, and that's across all healthcare professionals as well. I think the other big thing for us is that we have to reflect on our practice as part of our professional registration. And although as a radiographer, it's not necessary for me to do that in aesthetics, it's something that we automatically do because we've had it so ingrained into us when we trained. But that being said, that doesn't make us necessarily any better than people from other backgrounds, such as beauticians. They will still uphold their own standards, which can be just as high as ours. They will still respect people's confidentiality and they will reflect on what they do. And I know some really awesome beauticians that do a brilliant job. And there's groups that we have on Facebook where we all support each other as well. And I've actually almost seen more support from the non-medical professionals than I have from the medical professionals. So actually, in terms of whether you should go to medical professional or non-medical professional, this is where that is up to you, and hopefully I can make it a bit easier for you to make a decision, because as I say, just because they're a medical professional, it doesn't necessarily mean that they're working to the safest of practices. So there are a few things that you can do to help, apart from asking about their insurance and their qualifications. You can ask them whether they have access to a prescriber if they are not a prescriber themselves. So doctors and dentists are automatically prescribers. You also have a lot of nurses that are prescriber nurses. Pharmacists can prescribe, and quite a few HCPC registered professionals can prescribe as well. If they don't prescribe, such as myself, I don't prescribe, but I do have a prescriber that I work very closely with. And being able to have access to her is really good for if I've got any queries, or if I'm concerned about anything. It's also really good if if we were querying an infection, so that she can come and see my clients. But probably the most important thing is that she prescribes emergency drugs for me. So I hold adrenaline in stock, which every practitioner should hold, just in case someone has an allergic reaction. And the other one is the drug that dissolves filler. Hopefully you should never get to that stage, because there are things that you can do to prevent it. But if it does get to that stage, it's being able to have that drug to dissolve it, and know what to do and the repercussions. And also, I think it's starting to get good practice now to do a patch test, just in case someone's allergic to the drug that dissolves it. The other aspect is, if you are not a prescriber, then you should be working with a prescriber to do face-to-face consultations for Botox. Botox is a prescription-only medicine, and you should be having regular face-to-face consultations with a prescriber to be able to have that drug safely prescribed for you. You shouldn't just be able to go to someone and just randomly have it because you've decided you've had it. You should always be seeing a prescriber straight away. And they're there to check that it is safe for you, and if there are any problems, then they are there basically to help you and your client. You should also ask the practitioner where they get their products from. So I have been approached by people on Instagram and even WhatsApp to buy Botox from them, and because Botox is a prescription-only medicine, it should only be bought from a pharmacy legally. And in terms of safety, if they're not getting their Botox or their fillers from a pharmacy, you can't guarantee where it's come from, or where it's made of. So it's really important to ask that. There are a lot of websites online that will just sell anybody Botox without showing the certificates or the insurance. But actually, every online pharmacy that I'm connected to, and there's about 4 or 5 of them, they've all asked me. So it's good practice for people to know that if they get it from a pharmacy, then the chances are it's going to be safer than if they've got it from someone from WhatsApp. The other thing is, you can ask them about complications and what they would do and how they would recognise it if it was going to happen. And with me, for example, I always tell my clients, this is what I would expect to see, although nothing is ever textbook, and if this was to happen, then this is what I would do. And all my clients know that I hold the drugs in my box that's in my room, just in case. Most people should be able to recognise basic complications, and also severe ones as well. So if it's a vascular occlusion, which is a blockage of the artery, you might get whiteness, you might get severe pain, you might get mottling of the skin as well. So it's working with your client and watching them and assessing them, and being very sensitive to how they are, so that you can recognise when it happens, and just having things in place just in case. So I have my protocols printed up under my medicine cabinet, so that I know I've got the backup there if I need it, and I always make sure that my nurse is available as well, just in case I need her. And I've also worked with another few practitioners as well for extra support if I need them. The other thing is making sure that you've got the option of having free consultations. I'm really not a big fan of charging for consultations. I don't think it's fair, because I think that people are then obliged to go with you if they want a treatment done, because you've given them the money off that they spent on the consultation. But actually, I think if consultations are free, then there's no obligation, there's no pressure to go with them, and it gives you an opportunity to have a feel for that person, because it works both ways. It's a relationship that you're building, and you need to make sure that you feel comfortable with them, and that you feel that you're being listened to and not just heard, to make sure that you're on the same page, so you can get exactly what it is that you're after, and also that your expectations are managed as well. There's a lot of people that think that 1 ml of lip filler is enough, but actually it can be enough for some people, but but nowhere near enough for others. So it's being able to manage that expectations based on the practitioner's experience, but it's being able to have the option of having a consultation to talk to them in the first place. The other thing is when you're actually going for your treatment, to make sure that they give you a full medical history. They need to make sure that there's no medical conditions or medication that could affect the fillers, Botox, or anything else that they do, really. And for you to be able to have informed consent, so you're agreeing 100% of the treatment, you need to be able to know what the benefits are, what could potentially go wrong, and actually what the alternatives are as well. And that's come out of the Francis report from a few years ago as well, that everyone needs to be able to have access to that information. Otherwise they can't say that they've had all the information to be able to say yes for definite that they understand. Another thing to watch out for is when it's too cheap. So there are certain syringes which do not come as half mils, such as Revelax. So if someone's offering half a mil of Revelax, I would be concerned, because it doesn't come as halves, which means they're splitting syringes between people. And they've obviously got an infection control risk there. And a lot of insurances won't cover it either, so just be aware of that. And Botox and fillers are actually really expensive to buy for us. So if they are doing it cheap, I would be really concerned as to how they are doing it cheap. Botox is prescribed for one person, so if it's too cheap, they might be sharing it between two people rather than destroying the rest after your treatment. So I would just be concerned about that. And ultimately, follow your guts. If there's anything that doesn't make you feel comfortable, then don't go ahead. You should never feel pressured into doing a treatment. You should feel relaxed. You should be allowed to be given time to choose, and you should just never feel like you're being pushed to do it. It's always your choice. So that's the best thing that I can do. Hopefully that's helped. We've got a blog as well being published this week, so it's the second week of January. So if you wanted to actually see all this in paper rather than you writing it all down, you can copy and paste it from the blog, so that you've actually got something to take to a practitioner, so you can ask these questions. Hopefully you can also get a feel for people if you talk to them online as well. So I do online consultations because I understand that sometimes it's a bit pressurized coming in. But if you ever want to ask me any questions, please feel free to write comments on the blog or email me, or you can always text me as well. My number's on the website. So good luck, and I hope you have a safe journey. Thank you very much. Bye-bye.